Good afternoon, everyone. Today we talk about the effectiveness of combining laser and cryothermotherapy for sports injuries. Let me briefly introduce myself. My name is Maurizio Gioda. I have a degree in sports and exercise science. I am a physiotherapist and osteopath, and I am the co-founder of the Kineteos practice in Turin, where we offer rehabilitation and prevention therapies for adults, young people and athletes. I am a university lecturer in sports and exercise science, a lecturer at an osteopathy school, and a product specialist for physiotherapy equipment. I mainly deal with laser, ultrasound and cryo-thermal therapy, as well as some devices that also emit electrical signals, mainly neuromodulation and microcurrent, for which I am considered a specialist in Italy. Today we are talking about the importance of lasers in the field of rehabilitation. Let's start with the literature review. You can see that in this case I have used the English terms sport, injury and prevention. So let's look at the literature on meta-analysis reviews and systematic reviews. You can see that we have a total of 424 articles for the 2-year period, 2023 to 2025. If we search for rehabilitation rather than prevention, we get about twice as many results. That is to say, more than 800 articles dealing exclusively with rehabilitation in the field of sports injuries. This is certainly a very important topic that we need to address, precisely because sport is increasingly pushing athletes to maximize their technique and performance, thereby increasing the risk of injury. Basically, we are talking about laser, cryo and thermotherapy. Let's start with cryo and thermotherapy, that is to say, the exogenous application of heat and cold, which in our particular case has a specific therapeutic purpose, namely to treat damage caused by sporting activities. Why did I fall in love with this method? Because it is a method that allows me to work not only with athletes but with all types of patients, young, old, adults, amateur athletes, amateurs or professionals. Above all, however, because it is a method that, as we shall see, allows me to address a pathological aspect of the change in tissue biology and thus restore certain properties. We know very well from various studies in the literature that the application of heat or cold, whether extremely high or extremely low, that is to say above plus 45 or below negative 15 degrees, is strongly discouraged as it would quickly lead to damage at the cellular level. However, we also know that the wrong application time can result in inappropriate treatment and have undesirable, sometimes even harmful effects. So what should you know then? You should know the ideal temperature and application time in order to use both heat and cold safely and achieve the expected biological stimuli. There are various studies, such as the one by Frere from 2016, which is presented in this slide, and shows that the application of cold can increase vasoconstriction, thereby reducing the amount of blood in the capillaries and also the saturation of hemoglobin transport. This is a very important study which, when analyzed in detail, allows us to understand how, in the case of inflammation, the application of cold, even if only for a short time, around 5 minutes, can reduce blood flow to the injured area without immediately causing severe vasodilation, which I will discuss later. The application of cold is therefore timed in such a way that it has a pain-relieving and anti-inflammatory effect and accelerates the biological repair process. What can we basically achieve with QMD's cryothermal treatment? We can work with temperatures of up to -15 degrees for cryotherapy or up to +45 degrees for thermotherapy. We can use a program called thermal shock, in which the temperature is lowered by 30 degrees within 45 seconds, which has an important analgesic anesthetic effect on the tissue. This is of course recommended when the tissue is difficult to palpate due to the patient's hyperalgesia or allodynia, as it allows us to achieve a temporary numbing effect so that we can then continue working manually with a laser or with another method that we consider most suitable for solving the problem. Contrast therapy, which we will discuss in more detail later, is a therapy involving cycles of heat and cold. We have heard that with QMD cryotherapy we can reach a minimum temperature of -15 degrees, but I advise against working below 0 degrees, as this is contact cold therapy and not air cold therapy. Temperatures below 0 degrees are recommended for a few indications, and even then I recommend not exceeding 5 minutes. In fact, I recommend that my patients work with ice between 0 and 5 degrees for a maximum of 3 minutes, then take a half-hour break and repeat this several times a day. What happens during this process? Within 3 minutes, we achieve a significant vasoconstrictive effect and thus also an anti-inflammatory effect as we reduce blood flow at the capillary level. This does not subsequently lead to a vasodilatory reaction, which serves to compensate for a lack of blood that could also cause damage. The thermal effect, that is to say the application of heat at 30 to 45 degrees, enables vasodilation, which leads to muscle relaxation. In this case, we also achieve an anti-inflammatory effect in the chronic phase. We know very well that the chronic phase is characterized by hyperacidity and circulatory disorders in the tissue. Improving blood circulation therefore means supplying new oxygen, reactivating not only the macrocirculation but also the microcirculation, cleansing the area of any waste products, metabolites and catabolites that have just been produced by the inflammatory process, and thus supplying the damaged tissue in the degenerative phase again. There are no time restrictions for treatment with thermotherapy, but we must always consider whether we only need a relaxing treatment or whether we also want to achieve an anti-inflammatory effect. As I mentioned earlier, the thermal shock is a transition from a warm to a colder temperature, a drop of 30 degrees Celsius within 45 seconds. It serves to reduce the sensitivity of the area where there is excessive sensibility and pain when being touched. We can use this program, for example, in conditions such as frozen shoulder to relieve pain during the mobilization phase, as well as in all painful preoperative or postoperative phases. The same applies before shockwave treatment, as we do not achieve any significant vasoconstrictive or vasodilatory effect, but only a shock at the level of the nerve endings, which reduces pain sensitivity. The contrast therapy program that I personally use most often consists of heat-cold cycles. In this application, we first work with heat and then with cold, or vice versa. It not only has a specific draining effect, as in the night method, for example, but also a muscle-relaxing anti-inflammatory and analgesic effect. We will see later how important it is to combine this form of therapy with alternating heat and cold, especially in the inflammatory phase before applying the laser. I will be brief and not bore you too much with the basics of laser therapy. We know, of course, that therapeutic lasers are based on the emission of photons that are absorbed by the molecules in the tissue, and that this type of absorption causes a change in biological processes. That is to say, induces biological processes. Absorption is related to the wavelength at which these photons are emitted. The radiation is absorbed by a specific area of the molecule, which is then set into vibration at a specific frequency. This triggers various cellular mechanisms through the change in molecular structure. Of course, if we want to achieve valid, reliable results with laser therapy, we need to take a number of important parameters into account, such as the different wavelengths and frequencies. The wavelength used are specific wavelengths that correspond to the absorption spectrum of human tissue, have already been studied and are known to be effective from a therapeutic point of view. The wavelengths are of course measured in nanometers. There are important studies by researcher Tina Karu on this topic. The wavelengths that are most interesting to us in laser therapy are of course in the by Tina Karu determined therapeutic window between 750 and 1300 nanometers. We know that wavelengths between 200 and 350 nanometers are absorbed by proteins and nucleic acids. Wavelengths between 400 and 750, on the other hand, are absorbed by melanin and tetrapyrrole compounds. Therefore, we must remain within the therapeutic window between 750 and 1300 nanometers. Which wavelengths can we use with QMD lasers? The top model in the product range allows the use of 3 different wavelengths. 808 nanometers is a wavelength that is available in both top models and is characterized by good penetration depth and biostimulating properties. At 808 nanometers, melanin creates higher resistance, which is why caution is advised, as problems can arise if we remain in the same spot for too long. This wavelength is very well suited for acute inflammation, as the water molecules create relatively low resistance because they have a different absorption spectrum. 1064 nanometers are the most widely studied wavelength and the first wavelength to be used in therapeutic lasers. It has good penetration depth, good analgesic properties, and is very versatile. Melanin does not create much resistance, but water molecules absorb the photons more strongly. In acute inflammation with excessive edema and water, this can lead to strong resistance, which significantly reduces the effectiveness of the laser. The wavelength of 1120 nanometers is very specific. Studies show that wavelengths between 1100 and 1160 nanometers are particularly well absorbed by serotonin, substance P, dopamine, and histamine, all of which are substances that are present in high concentrations in acute inflammation. In the early stages of inflammation, we therefore experience pain in addition to substance P, as this is a substance produced by nerve tissue in the acute phase. The 1120 nanometers with which the Helios model, the top model in the QMD laser series, is equipped have excellent penetration depth and, as we have heard, a broad absorption spectrum. Melanin produces relatively little resistance, making it a specific wavelength that is particularly suitable from a therapeutic point of view for acute inflammation with painful symptoms. It is also suitable for contractures, as these are a secondary defense mechanism of the body in response to inflammation or pain. Other variables that we must take into account in order for the laser to be considered effective are the type of administration, that is to say continuous, pulsed or superpulsed wave, and the strength of the dosage. The laser must therefore be applied with different modalities and intensities. How does the emission work? In continuous mode, the laser is emitted with a constantly active laser beam, as shown in the graphic above right, which also achieves a thermal effect. In pulsed mode, the continuous emission of the laser is interrupted, which means we achieve a lower thermal effect and can therefore penetrate deeper into the skin. This reduces the possibility of a rebound effect and avoids the risk of tissue damage. Superpulsed mode is used exclusively to achieve a pain-relieving effect, whereby we achieve extremely high peak values, but with extremely low intensity over a short time period. There is also another emission mode, harmonic pulsation, in which continuous modulation of the frequencies takes place, allowing different molecules in the tissue to absorb energy. This gives us a range of therapeutic options, including biostimulation, pain relief, and anti-inflammation. Clinical studies have shown that the pulsed mode, especially when used at high power levels, allows for lower energy absorption at the surface, thus achieving greater depth. With the pulsed and superpulsed modes, we therefore have the possibility of reaching much deeper targets, as the saturation of the superficial photoreceptors is not achieved due to the off phases of the laser, despite a higher absorption of high energy photons. This is a summary slide that shows us what we achieve with the laser. At the tissue level, we have mitochondrial stimulation. We can convert prostaglandins into prostacyclins, thereby achieving an anti-inflammatory effect. We have hyperpolarization of the membranes and nerve fibers, thereby achieving an analgesic effect. We have a resumption of lymphatic peristalsis and thus a reduction in oedema due to the drainage capacity of the lymphatic system and an activation of microcirculation, which leads to a biostimulating and relaxing effect. In summary, we therefore have a biostimulating, anti-inflammatory, analgesic, edema reducing and relaxing effect. So, when do we use laser therapy? I have listed the most common conditions, but of course the list on this slide is not exhaustive. I have mentioned tendinitis, bursitis, enthesitis, tendinosis, contractures, trauma, etc. What do I want to focus on now? On the conditions that can occur, particularly in athletes. As already mentioned, the problem is that athletes, no matter how well trained they are and how attentive they are during training, naturally manipulate their movements during competition in order to achieve the desired result. In sports such as football, volleyball, basketball, or team sports in general, we are therefore increasingly confronted with manipulated movements aimed at achieving the final result. The goal is to score the point in volleyball, the basket in basketball, and the goal in football. In contrast, in sports such as swimming, there are movements that cannot be manipulated but must be performed with extreme care and maximum effort, which can also lead to problems. What are the classic problems in sport? In the absence of a serious traumatic event such as a physical collision, the most common conditions are, of course, inflammation of the tissues such as tendons and bursa, and thus all the conditions we refer to as tendinitis, myotendinitis, enthesitis and bursitis. These painful conditions naturally restrict joint function and athletic movement. How should these situations be treated? In cases of acute or subacute inflammation, such as clear tendonitis, we can use contrast therapy. In this slide, I have used contrast therapy in combination with ultrasound. With contrast therapy in combination with ultrasound, one cycle of contrast would be sufficient. Without ultrasound, we can apply contrast therapy in 2 cycles. That is to say, twice warm, cold, which allows us to reduce the oedema, that is to say, the amount of water molecules that would cause absorption of the laser and thus reduce its effectiveness. After contrast therapy ending with cold, we can therefore easily work with a laser to achieve an anti-inflammatory effect, for example. My advice is to work with the existing protocols, or in any case with all 3 wavelengths, that is to say 808, 1064 and 1120, especially 1120 as it is anti-inflammatory and biostimulating. The 1064 becomes fundamental and effective thanks to contrast therapy, as it has good absorption and reduces the water content in the tissue beforehand, so that we achieve optimization through this combination of the 3 wavelengths. After completing this laser session, I recommend finishing with cryotherapy. I recommend a duration of 1 minute, which is sufficient for a pain relieving effect and thus prevents the athlete from experiencing a slight painful exacerbation after the treatment. For a more joint-related problem, I would perform a 3-minute cryotherapy treatment In the case of chronic inflammation, however, that is to say, when we are dealing with more degenerative conditions, such as tendonitis in athletes who may come to us and have been in pain for months or years. For example, in the patellar tendon, treatment should be carried out as in the acute phase during the phase of pain exacerbation. In most cases where we consider it to be chronic, it is advisable to use a different treatment beforehand. Start with heat treatment, that is to say, warm the area well to stimulate microcirculation, then continue with laser treatment to reduce the inflammatory phase, and only then, if necessary, apply contrast therapy with a cycle that ends with heat. Finally, however, I would like to share a little thought with you concerning my experience, because the classic treatment protocol recommends 3 sessions per week over 3 or 4 weeks. Some even do 5 sessions per week over 3 weeks. Based on my experience with athletes, I prefer to do at least 2 sessions per day on 3 consecutive days, if possible. For some athletes who allow me to do so, I even perform 3 to 4 sessions per day, especially in the acute phase. This is because I have found that this allows me to act quickly and intensively on the inflamed tissue and thus reduce the inflammation immediately. The first session naturally consists of contrast therapy and laser treatment, while the second, third or fourth session consists only of laser treatment. Therefore, the first session of the day always begins with contrast therapy. You must assess for yourself whether this pathological condition is a disease with severe swelling or also involves the production of synovial fluid, or whether it is swelling without edema. Within 3 days, a slightly more aggressive technique with repeated applications is then used, followed by 2 to 3 sessions per week for 2 to 3 weeks until the therapeutic goal is achieved. If the problem is detected in time, that is to say, as soon as the athlete feels pain, I have found that the problem is completely resolved within 2 to 3 days with 2 to 3 applications per day. Therefore, in my opinion, the application for athletes differs slightly from the application for people who do not participate in professional sports and do not have the opportunity to come to your studio 2 to 3 times a day for 2 to 3 consecutive days. This does not mean that a non-athletic person cannot undergo sports treatment. That is to say, 2 to 3 applications per day for 2 to 3 consecutive days. Often it is just a question of scheduling, which depends on the person's availability. This brings me to the end. I hope I have met your expectations and wish you all the best and every success in your work.